We're going to look at some different techniques with supine neck massage, largely general Swedish massage. This is not a routine, but rather a variety of strokes that you can integrate and utilize as necessary. First is kind of a general warm-up, butterfly stroke, couple key points to make sure that the ending of the stroke goes all the way up into and through the occipital area. A lot of muscles and fascia connect up into the suboccipital area. And we're going to take a look here, looking underneath what's going on in the back of the neck when massaging a client supine using a plexiglass table that a graduate built for me. So here we are looking up underneath when you're massaging a client's neck in the supine position, some things you can do. So some of these techniques are going to perhaps seem rather repetitive and some small variations between one and the other. But for example here, when you warm up with petrissage and effleurage, the neck, let me actually pause that and go backwards a bit. So when you warm up with effleurage and petrissage, a lot of times just changing whether you're using both hands at the same time and repeating bilaterally in unison, or alternating left, right, left, right, left, right, left, right. Also changing whether you're pulling up towards the head or down towards the feet. Small changes like that can actually help you kind of get into the muscle layers gradually and differently, because you're going to really need to warm up a lot of muscle layers here. Let's see. This view can be a little bit confusing at first, but this is as if we are doing a cross section, and here at the bottom of the picture is the back of the person. We're at the level of about C5, cervical 5, with the cross section, and the top of the picture here is the front of the person. So when you're warming up in the back, you've got a lot of layers to warm up gradually. The trapezius here is the most superficial muscle, and it's actually pretty thin. And then you've got to work through the splenius, capitis, and cervicis, then into semispinalis, and then this little T-shaped structure is a cross-section of part of the vertebra, and here's the spinous process, sort of the straight up and down line of the T, and then the crossbar of the T is a transverse process, and right in here is the lamina groove, and you've really got to warm up a lot of what on most people are very tight neck muscles till you start getting into these deeper muscles in the lamina groove. And here we have semispinalis cervicis and the multifidi. So what you're going to see in this demo is a lot of repetitive strokes that may appear like you're doing the same thing over and over, but what you actually want to do is progressively sink deeper and deeper. And now what we're going to do is we're going to take a look at a stroke where you can actually reach across and warm up the whole shoulders and lift the shoulders. So it can feel really nice to pull all the way across the body and then sink into that medial border of the scapula, as well as the superior angle of the scapula, and pull the tissues all the way across. Now here's a critical, here we get to the medial border of the scapula, and of course once you're on the actual medial border of the scapula, you have the rhomboids attaching And there are trigger points for those rhomboids right along the border. And as you reach across and pull, it's good to make sure you use good body mechanics and lean back. Now this right here is a very critical juncture. When you get around C7 and T1 and you get in the lamina groove and close to C7 and T1, this is a real area for a bottleneck of tight tension that can be very difficult to release. And it's really tight on, probably about 90% of your clients. And it can be one of those tricky areas that a lot of massage therapists don't release well enough. And you're going to see me kind of go over and over and scoop deeper and deeper into that lamina groove. You can overlap your hands for more strength and more power. Use the table to press up in so you can allow the client's body weight to sink down into you. But here in that lamina groove around anywhere from C5 to T2, but especially in the C7, T1 region, that gets so bound up in people that if you only try to address it right in here when the client is face down, prone, it can be very difficult to release it as well as you need. Whereas if you have the client face up, you can allow their body weight to really sink in and relax as you use the leverage of the table to curl your fingers and rock and roll them upwards, using like a wheelbarrow leverage system. Now here working out with the deltoid. Of course you have the fibers crisscrossing broad area of the deltoid, and where they attach on the spine of the scapula is excellent area to do cross fiber friction and circular friction, and to really tease apart and separate those fibers that get tight and bound up. When you do the pulling and flushing strokes, pulling out on the whole shoulder, make sure you use good body mechanics and lean back with your whole body. And here using some nice counter pressure so it can really lengthen and stretch the muscles if one hand goes superiorly while the other hand goes inferiorly. Of course, if you're really superficial with this movement, you are working the trapezius, but you can also sink to the deeper layers. Again, you have a lot of layers of muscles to warm up in this area, and alternating left and right versus both hands together, moving superiorly versus inferiorly as you gradually sink through the layers can be very effective. Now getting deeper in the suboccipital area. This is a crucial area to release, huge area for people to hold tension. Probably there's a stress and or emotional component involved a lot of the times, but just even the mechanics involved there with the large weight of the head, and it's often our posture. We often have a head forward posture. As soon as we throw the head off of a good gravitational line, we have a lot more a weight to balance, like balancing a bowling ball on top of a broom. Now here what I'm going to show you is a view that you normally can't get when you're watching a demonstration of what's really going on when you're applying pressure to knots, adhesions, whether you're releasing trigger points or just an adhesion behind the back and shoulders. The plexiglass table lets you see some good ways to work in this area. Now, I'm going to be making a loose fist here, but something to keep in mind depending on the size of your hand and the posture of your client, sometimes people have a difficult time getting your hand into that position or are afraid that it might hurt the client. Well, a couple things to keep in mind. You do want to be very careful of the bony landmarks. So you want to palpate where you're going to be using tools. Palpate before you're going to be using tools like a knuckle, so that you don't get a knuckle right into the spinous processes, for example. So you want to warm up and palpate the area, but then you can also start basically with a flat hand and then get the shape of a fist, so that you can use different aspects of your knuckle depending on the size and shape of your hand versus their posture. Now, a couple tips and pointers. A lot of students especially have a hard time doing this in a seamless, smooth manner. One thing that is not evident using a glass table is that you can use the squishiness of the tabletop to press down into the table while you get your hand under flat and then make a fist. Couple other things you can do. You can use your other hand to actually lift the client's upper back up while your other hand scoots under. And another thing you can do, if neither of those strategies works, is actually to use your hand and slide it underneath the bottom sheet, which will kind of give you a slipperier surface to slide under and then get in a position of a fist. A couple pointers when you are actually going to use the fist. Once you're actually on an adhesion and you're in a good position, just like any time where you would use compression, like prolonged ischemic compression effectively, or myofascial release effectively, or melting linear friction effectively, you want to work slowly and patiently enough so that the knots and adhesions, trigger points, actually have time to release, so that the extra cross connections in the collagen fibers actually have time to release. And real advantage here when the client is supine is that if you are patient and you are listening with the tissue, you can actually use the weight of the client to your advantage, so that you're not pushing down into the client like you would when they're prone, but that you can actually patiently wait and allow their body to release into your hand. And my other hand is offering a nice counter pressure and stretch in this position. Now you could be using, like I said, just a simple prolonged ischemic compression, a linear friction, or actually be quite lovely to use myofascial release in this way as well. And then the hand that's more superior in the suboccipital area, using the fingers to hook into the fascia in the suboccipital area. Always good after doing deeper work to flush and soothe the area. Effleurage, petrissage, warming friction. You want to flush out the area, flush out the waste products, bring the oxygen, the fresh oxygen, in with the fresh blood. Here you'll see a little bit of a counter pressure where the superior hand with the curled fingers is pulling right up into the suboccipital area, and the inferior hand is pressing down. Now it's pressing up. I started off with a downward counter pressure. Now they're going in a more similar direction. You may be able to tell from this view now that the superior hand, the curled fingers are applying a fair bit of pressure, where the rest of the hand is that kind of supported starfish hand where all the surface of the hand is squeezing. It's really important whenever doing neck massage to offer really good, comforting stability to the head and neck. We protect and guard our head, and with that large weight that we're carrying and balancing, we need to always give the client the message with our hands that we have got their head in a excellent, stable manner so that they can let go. Here you're seeing some nice flushing, and here's that key little T-square area right around that lamina groove, right around C7, T1, very area that gets very tight and bound up. Moving back up to the suboccipital area, this feels really exquisite to flush the tissues out here, pulling them down, pulling the fascia away from the skull now. Squeeze and flush, and pull that fascia. All these layers of neck muscles get pulled and tight, taut up onto the periosteum of the skull. And when you really pull that fascia down inferiorly, it can release the tension of the entire scalp. And it can be quite relieving to pull those muscles from their short, tight, bound up position of neck tension and pulling it down. Here you can probably tell I was getting more specific right in the lamina groove. Varying your speed can be nice. There were some more repetitive, quicker repetitive strokes like effleurage, and then some slower, patient strokes. As you warm through those layers, you're going to find tighter bands of muscles in the neck, and you're going to find tight adhesions. Some of those tight little knots, when you press on them, may actually refer pain that is just like a headache. So if a client has a trigger point in their neck muscle and you press on that trigger point, it may make the same pain they feel when they have a headache, because those trigger points can actually cause headaches. But when you release the trigger points, it can release that sort of tension headache. Now, here, grabbing into a tighter spot and then moving the client's head and neck. Whenever you move the client's head and neck, you want to make sure that your movements are supportive and deliberate, that you have the weight of the client's head firmly and supportively in your hand before you move. Now here I'm going to get into a nice tight spot, get into it with a knuckle, and then move the client's head and neck using the weight of their head to press into that tension point. It's a nice way to add the weight of their head to help work out the tension. Now similarly, you could grab the same tight spot, engage the tissue, engage the fascia, and actually move their head away from it to stretch it. So it can be equally effective to move the head and neck into the tight spot and away from the tight spot, but they're working in different ways, working with the point directly or stretching out the short, tight fascia. And as we'll learn when we do myofascial release and trigger point work, once you release a trigger point, it is highly effective to warm up the area, flush the area, but also to stretch the area. So if you do take a tight spot and you release it, it's very effective to stretch it afterwards to actually lengthen the tissue. Some of this may start to look a little bit redundant, but there is so much neck tension and so many layers of little muscles that a lot of times to do effective neck work, you have to really patiently work through the layers. And you'll start off with kind of big general areas of tension. Sometimes you might feel like a big cable or just one big tight area. And it isn't really till you start warming up all the layers that you start to actually feel the different layers and the different little ropes, the different little tension points. As you get really close to the spinous process, wherever you get to an attachment, whether it's origin or insertion, where that muscle attaches, that tendon, the fascia, literally weaves into and becomes the periosteum, the living connective tissue, richly vascular connective tissue layer on top of the bone. And it not only has a rich blood supply, but it actually has a nerve supply. So whenever you're close to those origins and insertions, it may actually be quite tender, sometimes exquisitely so, and sometimes it may even feel to the client like you are actually pressing on their bone or bumping into their bone too much, because it can be quite tender. So you generally want to really warm up the area, approach with a little bit of caution, and communicate clearly. Doing a little bit of general movement of the shoulder girdle. And this here we're going to do a really short, not a complete, but just kind of a really short little bit of a work with the sternocleidomastoid, SCM, using a nice pincer grasp with the posterior part of the hand with a nice soft curve, creating a shelf for the thumb to press the tissue in. Now, it can take quite a lot of practice to be able to confidently grab the SCM and roll through the layers of tissue slowly and firmly without just having it slide out of your hands. The SCM undergoes a tremendous amount of tension, both because of postural reasons, and even when we get into the anatomy trains and myofascial release, it has exertional forces on it, basically from the lateral line as well as the anterior line. So there, it kind of has double duty as far as ways for it to get stressed out. You can see a nice pink hyperemic response there. Whenever you're doing warm up with effleurage, petrissage, and warming friction, you actually want to not only be able to feel the tissue get warmer and softer, but you should actually be able to see that pinkening, the hyperemic response, where you're actually bringing blood to the area. And now that the area is warmed up, we're going to very slowly start to warm up the scalenes as well. Now, the scalenes are a really critical area to learn how to work well, but there is a big neurovascular bundle in the area of the brachial plexus, and so it's very important that you work in a more superficial way of engaging and stretching the fascia. So grabbing hold of that myofascia of the scalenes rather than poking or pressing in perpendicularly. I'll back up here for just a second. In that area right here, in this triangle, you do not want to press in deep and a perpendicular way, because right there you'll have the brachial plexus. And we've got a couple videos uploaded where I'm showing how to work specifically with the scalenes and specific safety around the brachial plexus. And in fact, there's one video where I show this on a skeleton model as well, so you can clearly see where the bony landmarks are as well. Here's a gentle stretch, and you can see the pink hyperemic response. We've brought blood to the area while we warm it up. and bringing in that blood is always important, to bring in the fresh oxygen and flush out the wastes. Here again, the brachial plexus is coming out between the transverse processes and branching out here, going under the clavicle. So you do not want to press down inferiorly in a perpendicular direction in this area, but rather want to engage the fascia with a flat thumb or ulnar surface of your pinky, or in other words, grab hold of that fascia and give it a nice stretch rather than poking in. There we had hold of the clavicle a little bit, and here back to the SCM. And we'll do a lot of practice with the SCM. It takes quite a bit of practice to get good at it, but one way to start getting good at working with the SCM is to practice on your own SCMs a lot. You can practice on your own SCMs during a lot of different activities. You can, if the arm position gets tiring for you and you're practicing on your sofa or something, you can support your arm on the sofa. But it's critical that you get skilled and confident with the SCM, and most students feel afraid when they work in that area and at first. And it's probably better to have a healthy sense of caution in the area at first. And we'll talk about the safety and go over this, very slowly, but some reminders before you start delving into the SCM area is that the carotid artery does run in the area. So whenever you're working with the SCM, you always want to carefully feel what is under your finger, what is under your thumb. And if there is a strong pulse directly under your finger or thumb, you need to move. Another thing is that people can feel vulnerable in this area even if you're not on their carotid artery. And so, especially when you're working the SCMs or scalenes, you want to work one side at a time. So see, my other hand is supportive. You want the other hand to be supportive behind the occiput or on the head and neck, and only work one side at a time. You do not want to pincer grasp somebody's SCMs bilaterally at the same time. One thing you want to be able to do with practice here, and I get to another SCM shot here, is you want to be able to hold that pincer grasp nice and slow and steady so that you can slowly roll through the tissue. So when you first start working with it, it may seem like a relatively thin rope of a muscle. But first of all, there are two heads that branch off at the bottom, but actually throughout its entire course, once you can grab onto it and have it not just squirrel away from you or slip out of your way, you can actually, it's a rather thick muscle actually, and if you slowly can roll through the layers of tissue, there are a lot of trigger points. I don't have a good picture right here, but there are basically trigger points all the way up and down the sternocleidomastoid, and if you go rushing through the sternocleidomastoid, you can miss a lot of the tight spots and a lot of the trigger points. So practice on your own SCM a lot, and then slowly practice with somebody else, one side at a time only. Be very careful to direct this pressure towards the back and not towards the front of the neck, which can feel like you're choking the person. Always move if there's a pulse, and always use your other hand in a very supportive manner. Nice, slow, steady movements. And flush it out. Do some general flushing of the tissue. You can see by the way his head and neck are moving that I'm getting right up through the lamina groove. And you always want to take those strokes all the way up into the suboccipital area. Really fantastic to release that tissue. And then with a flat hand, you can actually get those strokes all the way down to T5, T6, T7, T8, and then release the tissue and the fascia around the ears. Good scalp scrub.